All right, we are now live. And thank you so much for joining me. This is Quick to Politic. I'm Ernestine Lyons, the host of Quick to Politic, the podcast and web series. So we are talking today with some organizations that are all about helping Michiganders through, challenges and tough times. And so with me today are MaryJo Harris of CARE of Southeast Michigan. And so CARE of Southeast Michigan provides professional and emotional support services to those seeking to change their lives. And these are the primary focuses on, they're focusing on substance abuse, prevention and recovery, harm reduction, and other mental health challenges and personal and workplace issues. And then I'm also being joined here today by, okay, and I want to make sure it's Tinetra Burns, and she is with Detroit-Wayne Integrated Health Network. And Detroit-Wayne Integrated Health Network is a compassionate and committed, it's compassionate and they're committed to the 75,000 children and adults that live in the Metro Detroit and Wayne County area. They understand the immense responsibility and they're prepared to go above and beyond supporting the people, and they are a system of care. And so thank you so much, ladies. We're also going to have someone else from Detroit-Wayne Integrated Health Network joining us later. So she's just going to jump right in here. But do you mind telling us a little bit about yourselves and your roles, and just the work that you do? We'll start with MaryJo.
Sure. Thank you so much for having us, Ernestine. It's so important for the community to know the resources that we have out there that are available to them and that are free to them also. So I work for CARE of Southeastern Michigan, as you said. I co-manage a coalition called Healthy Grosse Pointe in Harper Woods. The mission of our coalition is to just prevent substance abuse within our community and to provide mental health resources within the community. My funding is from Detroit-Wayne Integrated Health Network, and I work for CARE. The coalition meets monthly. We meet the third Wednesday of every month. Right now we're doing it via Zoom. And we have community members from Grosse Pointe and Harper Woods. We have school employees, we have city council people, and we come together to talk about how we can help community members overcome substance use disorders, how we can prevent people from getting substance use disorders, and how we can make sure that our community knows the mental health resources that we have out there.
Thank you so much for that introduction. And the Healthy Grosse Pointe and Harper Woods group has been amazing, and I've enjoyed working with you and Susie and understanding like what programs are there. And there was even an intern who came, and she was talking with us about ways to make sure that people are staying healthy, staying fit, and just providing that support. So thank you for joining us. And so, Tinetra, do you mind telling us a little bit about yourself and your role with Detroit-Wayne Integrated Health Networks?
Good evening, and thank you for the invitation. We're delighted, DWIHN is delighted to be a part of this podcast this evening. My name is Tinetra Burns, and I do work with Detroit-Wayne Integrated Health Network as a clinical specialist. And as part of DWIHN services, we have an array of services for the community, which means that we have an array of departments. And the department that I work in is clinical practice improvement. And so we are charged in that department to provide workforce development training for the clinicians that are working within our provider network. We also oversee, in my department, we also oversee many initiatives such as similar to, because we don't oversee the initiative that MaryJo is involved with, but we do provide oversight and initiatives related to trauma-informed care, related to suicide prevention, related to mental health jail diversion programs, just to name a few. And so with that, we provide direct oversight as we work very closely with our community on how to engage and improve services for those individuals that may have trauma or may be in need of trauma-informed care services, that may be involved with some type of law enforcement contact, whether it be police, throughout Detroit and Wayne County and our Wayne County jails. So that's just a little bit about, what we do.
Thank you so much. And as I was reading through your bio, I did see that trauma-informed care. Do you mind explaining a little bit about what that means and what the definition of that is?
Yes. So I think about 5 years ago, Detroit Wayne Integrated Health Network, along with the state of Michigan, began to research how some individuals that are diagnosed with behavioral health concerns also have had some or been exposed to some trauma. And with that, we learned that as a child, we looked at the exposure from 0 to 18 years of age. If individuals are honest about what occurred at that time. And what we learned is that it does impact their behavioral health, could be a contributing factor if the trauma was not dealt with, before the age of 18 or when they had turned over the age of 18. So what we did, monies was put in our budget so that I believe we have 8 providers partnering with us to identify the needs of those individuals. So what that means is that we provide specific trauma-informed interventions, such as the ACEs, which is Adverse Childhood Experiences, that captures the exposure from 0 to 18 years of age. And if individuals are truthful, because it is a self-report, if they are truthful, then those 8 partnering agencies will identify the best practice related to their trauma history. So we believe that anyone that comes through DWIHN's doors, through the provider doors, may have been exposed to some type of trauma before the age of 18.
Oh, okay. Thank you for shedding light on that. So in other words, you're really helping to heal the person from, any past baggage that they may have, and that might inform the way that people respond to, just life in general. So that's wonderful to know that a service like that is out there. But I want to jump right into one of our first questions, and this can be something for both of you ladies. Seasonal depression around the holidays statistically is always high. People are more isolated as far as, with the coronavirus goes, and COVID really has compounded things. So how can organizations like CARE and DWIHN, I'm going to start calling it DWIHN now too. I was like saying the whole title out, like, how can you guys help?
So yes, you are part of that.
Oh, thank you. But how do you guys provide help for specifically this time of year when people are depressed, and then you also have COVID making us all have to separate, and just how do we get help around depression and people being sad and isolated?
Yeah, so you want MaryJo to start first, or?
Sure. We can start there and then jump back to you.
Okay. So you're right, Ernestine. It's sad is difficult. Seasonal affective disorders is difficult enough without COVID, and then you have COVID in there, and the irritability, you're lethargic, you're tired, things that you like to do, you don't want to do anymore. So one of the things that the coalition is doing is really trying to get people outside to exercise, because that is so important. Getting fresh air, getting up from out of your chair, doing, we're doing Zoom meetings all day, we're sitting there all day. So getting people up and outside. One of the programs that we're really starting to push starting January 1st is called 1,000 Outside Hours. And we have it on our website. We'll have it on our Facebook. Just trying to get people out there. It sounds like a lot of hours, spending 1,000 hours in a year outside. But if you break it down and you think many of those hours are spent in the summer anyways outside, but just really focusing on spending at least an hour outside, doing some exercise, getting some light into your life instead of just staying inside. So that's one of the things that the coalition is doing. But the other thing is too, is really just making sure that we get out there the resources people need so that they know that there is help. The 1-800 number, we put a lot on our Facebook page of the coalition, and we have that number on our website too, because it's really important. I mean, you know, those things are easy to do, getting exercise, sitting by a bright window, calling a friend when you're having seasonal affective disorder. But let's face it, a lot of us need more than just that. We need help to get through it. And that's what DWIHN and our other local resources are for.
So seasonal affective disorder, this is an actual disorder that is, you know, clinically diagnosed. It's not just, oh, I'm feeling down and blue and somebody, you know, comes in and says, buck up. It's an actual thing and, you know, with a term.
And that's the thing is, I think that, well, and there's, you know, there's depression that goes along with it. So that's why we make sure that it's so important that people know that there's resources out there to help them, and they're not sitting inside suffering alone and not feeling that they can't talk to anyone and not being embarrassed by it either.
Thank you for shedding light on that, and hopefully like some of us can go out there and get a little sunshine. I know with the snow and things it can be hard, but just taking walks and, you know, stepping away from your desk. And I'll definitely add the link to the 1,000 outside hours there. And so let's have your weigh in there, Tinetra, on the same question around, you know, just the compounded isolation and then the seasonal depression around the holidays and how DWIHN is there to help.
Yes, yes. Thank you, MaryJo, because I did not realize that you all had that specific programming going on. So that's excellent. Yes, we would refer anyone that may have those signs and symptoms of seasonal, you know, depression to call our 1-800 number, which is 1-800-241-4949, and they will participate in a brief screening. And then based on those responses, our access team will refer them to the most appropriate provider to provide some help, some relief, similar to what MaryJo mentioned. They will have, you know, an evaluation, and depending on the signs and symptoms, you know, they will receive some direct treatment. But the best thing that DWIHN is doing, if you look on our website as well, we are also promoting self-care tips. It is so important during this time to take care of yourself. We do a lot of training, like I mentioned earlier, and mental health first aid is one of the trainings, and which we go into the community and we teach to law enforcement. We teach to just about the lay person in the community. You don't have to be a professional to learn more about how to take care of your mental health, because it's impacted. Definitely COVID-19 has impacted our mental health even more so now that we are now at the end of the year. Seems like it just was 6 months ago. We were in March, and now we are, you know, at the end of the year. And so and there has been a lot of loss along with the seasonal depression. So individuals are also thinking about what occurred most recently, you know, or even 6 months ago. So self-care, it's so important. Doing some of the things that you love to do will help, you know, change your mood, change and improve your mental health. Just being mindful in the moment and what you can control is so important, which is one of the interventions that our providers or our clinicians are able to provide to teach people how to meditate, how to exercise. Yoga is a great exercise during this time as people, you know, recognize that they may, you know, be in a depression, whether it's related to the seasonal or just what we've been going through the last 6 months.
Thank you for shedding some light. And we actually got a question here from our viewers on Facebook, and they wanted to know, as far as some of these services provided by both organizations, you know, are there Zoom or Skype or phone call services that, you know, maybe folks can walk people through, you know, a little bit more about seasonal affective disorder or self-care and things of that sort?
Yes. Again, if they call our 1-800-241-4949, that is our access number. Not only is it our access number, it is also our crisis hotline. So if any individual believes that they are in high acuity and they believe that they need more interventions or services, please do call. A clinician will, evaluate, give the person a brief evaluation so that they can make the best referral for an appointment. But
and that number was 1-800-241-4949?
Correct.
Okay.
Correct.
Right. I'm going
to. And we do also, because of COVID, I just remembered, we do also have another hotline for Reach Us Detroit. If they believe that they don't want to do anything formal, like, going into our quote unquote system, but they do want to talk to someone or text with someone, they can call this Reach Us Detroit line. And give me a moment while MaryJo is speaking, and I'll get that number to you. But these are some tips that can be for anyone 13 ages and over can call both hotlines if they believe that they are in crisis. And yes, specifically because of COVID, most of our providers, if not all, but most of our providers are providing services via phone or through Zoom.
That's awesome. And thank you so much. Okay, and it looks like we have Karra here. Thank you so much for joining us. I love that background. And so, thank you for fielding that question. And so the same is for you, MaryJo. Are there any services via Zoom to really accommodate our virtual lives now, since we can't meet in person, for, just some of these services when people are looking to calm some of their anxieties?
Definitely. Well, the other night we had a program through DWIHN called QPR Suicide Prevention. It was a webinar via Zoom. We'll be doing more of them throughout the year. DWIHN does at least, I think, 2 a month via Zoom, and it's a good webinar for anybody. They call it similar to CPR. It's QPR, Question, Persuade, Refer. For anybody to learn how to help someone who they think may be suicidal. We had quite a few people on it the other night, varied group of people from parents to coaches to teachers who wanted to learn more about helping someone who may be depressed, and just how do you ask them, what do you ask them to find out if they may be suicidal, and then what do you do from there? So we'll be doing more of those programs through DWIHN throughout the coming year. Also through CARE and the Coalition, we do different programs on dangers of underage drinking, Zoom webinars on that, Zoom webinars on the dangers of nicotine and vaping with teens. Because what we've noticed, and we all know this, throughout the pandemic, people are using more alcohol. People are turning more to substances to help with some of their issues. So we are doing lots of different programmings throughout the month on dangers of drinking, dangers of marijuana smoking, and dangers of vaping. And we always have those on our Healthy Growth Point Facebook page and on our website.
All right. Thank you so much for that information. That actually leads into another question that I do have, around fear and anxiety. So, we have a lot of fear and anxiety around our own health and around the health of our loved ones, and the fear of losing people, the financial situations we're all facing, the fear of job loss or loss of support services that you rely on. So we've been seeing these increasing numbers around, just substance and, the Metro Detroit area for substance abuse, domestic violence, and suicide. So how I know MaryJo, you just shed some light on those, but what are some other ways that, CARE and DWIHN are there to help, just really alleviate some of the pressure that family members will then have when you're dealing with a family member who has substance abuse issues and or is feeling suicidal?
I think that's a question for Karra since she's on now.
Okay,
Is
and
she on?
I do believe Karra does have to she may be muted in just until about 7:30, so she may be here but not here. So
Okay.
I'll just have you ladies take the floor until she can join us. But yeah. So are there any things that you want to shed any light on that, Tinetra?
Yes. Like I mentioned earlier, DWIN has various departments, and so Karra works directly with our substance use department. So I can just shed just a little bit of light on what those particular services are. Definitely, we have an range of substance use providers directly and prevention providers. And so anyone, same thing, the 1-800-241-4949 number is the access number for those particular services as well.
All right, thank you. And then when she's able to join us, we'll jump right back into that question. But I do want to circle back to MaryJo on just particularly like with services when it comes to domestic violence and then substance abuse. And I know I want to catch that date that you mentioned for you said it was a town hall that has to do with just kind of helping folks get through things like this.
Well, we can, if any group is interested in having what Tinetra was talking about, the mental health training or the QPR training, they can reach out to me or to DWIHN, and we would be happy to do a webinar when it's good for them. It's, one thing that the coalition works a lot with teenagers in the school, and it's hard because the kids are not obviously in school. So in the past, we were able to go in the school, set up tables for what we called them Mind Matters Days or mental health days. And we would have lots of information and resources for the teens about mental health. And obviously we can't get in the school to do that. And so we're looking for ways, to work with the students to get this out to them. So Harper Woods High School had an idea. We're going to start a wellness club with the teens. We just put the flyer out a couple weeks ago. We're hoping right after the first of the year that we can have a group of teens that we can meet with to help come up with some ideas to get these resources to them. Last year, we met with a group of teens at Harper Woods High School, and they came up with the idea of Mind Matters. And they made these bracelets that say, Mind Matters, I Matter. When we handed these bracelets out at the Mental Health Day. And it was really successful. We had therapy dogs and tables with, adult coloring pages with sayings on there that were uplifting. So we really want to continue doing this stuff with the teens, but just trying to figure out a way to get it to them.
Right. And I think that can be, I don't think people think about young people as having a lot of stress put on them because of these situations. You're with each other all the time indoors, especially with quarantine. You're not having that outlet and that ability to go off and socialize with friends, blow off steam. And so, this can be a very trying time for teenagers as well. And so I'm actually really glad that, you're partnering with Harper Woods in such a way. And, hopefully with just vaccines, that we can start to get back to normal. And I know it'll be a while before, everyone has access to it. And I know, so that actually leads into another question that I wanted to pose to you guys about, just what should we really be anticipating as far as vaccines and distributions, as far as, just people's fears and their anxieties around getting access to the vaccine. When is this virus going away? And so, just working within organizations like yours, how are you guys getting messages, to the people about the reality of distribution? And we can start with MaryJo.
I was actually going to say this might be a better question for Tinetra, but as far as the coalition goes, our biggest thing is just making sure that we get the right information out there. So whatever information, we work closely with the 3 hospitals here, Beaumont, Henry Ford, and Ascension. In fact, I had tonight at the same time on our Facebook page, we had information about Henry Ford's webinar on the vaccine and testing. Because I think people still have questions about when I get the vaccine, you know, what's happening then with the testing and the antibody testing. So as a coalition, we will continue to get all that information out there. So I encourage people to like our Facebook page, DWIHN's Facebook page, and we'll get that out there. If the Harper Woods community or the school needs something separate, we can always have one of our doctors from one of our hospitals do a Zoom meeting or whatever the best way is for the doctors to get that information or the scientists to get that information to our community. We'd be happy to do that.
I may have to take you up on that, having a, just a info session on, just distribution schedules and, availabilities and the realities behind it. So
I think we should, Ernestine, I think that's a great thing. And I'll look into doing that so we can do that right after the first of the year.
Awesome. Thank you so much for that. And so Tinetra, same question around, just vaccines and the realities so that people are actually prepared for what this is actually going to look like for 2021 and 2022.
Yes. Well, I have not really had any conversations about the vaccines with my organization, with my director specifically, just because it's so new. Like, within the last 3 weeks, they are, have been identified some vaccines, I guess, from Pfizer and Moderna. But I agree with MaryJo. I'm sure DWIHN will continue to have as much information out for our consumers as well as our provider network that will keep all of Wayne County and throughout Detroit informed as well as safe, so that people can make the best, informed decision for themselves. We definitely at this time, we practice all of the CDC guidelines. We relay that throughout our whole provider network. And so each and every one of those organizations are also practicing the CDC guidelines. And this is just my personal and professional opinion of what I know about the vaccine, even when it does become available, and we really don't know when it really is going to become available for just the regular community, you still will have to practice the CDC guidelines, at least throughout this year and maybe the beginning of not only this year, but throughout 2021 and maybe the beginning of 2022, just because of the research and just because of the masses that will have to be, vaccinated. So we just want to make sure that everyone is informed and following the CDC guidelines as best as possible throughout this process.
Thank you both for shedding light on, such a kind of nebulous topic. I do want to just jump right into another aspect of behavioral health. This year we've had a lot of strife and conversation around, just the community and policing and, what community policing actually means and what it entails. And I was actually very pleasantly surprised to hear that behavioral health specialists are going to be teaming up with Detroit Police to respond to mental health issues in police calls. So I actually wanted to discuss what this actually looks like and if other cities can replicate this model.
And that for me.
Well, yeah, I know that Detroit Wayne Integrated Health actually had a big giant press conference with Chief Craig. And, this is something that I had no idea this was going to actually happen. I know there have been a lot of protesters who have been asking for having, social workers or mental health experts to accompany police to calls that have to do with mental health. to help de-escalate the situations. And, you know, to me, it kind of sounded like something that's very new agey, and I wondered if it actually could happen and it would be practical to actually, you know, make that a reality. And then to hear that that's something that, you know, now Detroit Way and Integrated Health is actually working with the police on, it's just like, wow, this is truly surprising and exciting.
Yes, yes. This is one of the initiatives that my director, Andrea Smith, oversees, and I am and so delighted to be a part of this initiative. We do, and we've had some behavioral health organizations partner with, specifically, we're talking about the city of Detroit, but not in the mass is what was described in the news conference. And so, yes, we have at least 3 organizations that will be partnering specifically with DPD, Detroit Police Department, with their law enforcement partners, or with their law enforcement staff that has also been trained specifically to manage mental health runs or mental health situations. So you have 2 things going on. You have law enforcement that is receiving this crisis intervention team training, and they will partner with the behavioral health organization. So those individuals, when a call is related, that it has been identified that it is related to a mental health run, they will get those particular calls or runs at those precincts.
Thank you for shedding light on that. And I'm wondering if, you know, if there's any practical application to other cities adopting a similar model.
When you say cities, are you talking about cities within Michigan or across the
Across Wayne County, you know, maybe
Wayne
replicating
County?
the same. Mhm.
Well, definitely, if other law enforcement agencies are interested in partnering with, a behavioral health provider, they will, seek out DWIHN to do that. And more than likely, it would probably be under the same department that this is under now. And so it is a new charge, as you said, but it's definitely needed. We provide, like I said, mental health first aid training to law enforcement, and we've provided, I don't know, to thousands of law enforcement officers in various departments, such as the city of Inkster, such as the city of Dearborn, Plymouth, Northville Township, just to name a few. And they all have said that 60 to 80% of their runs within at least the last couple of years that I've been involved with this initiative has been related to a behavioral health run. More people are in crisis, just, maybe because of trauma that they've experienced and have not been able to manage that, or just nuances or situations that bring on mental health challenges. And so DWIHN is working very closely with some other agencies. It may not be in the same manner as DPD, but we do have a crisis. And the name escapes me right now, but it's through one of our providers. Well, it's a crisis team that do partner with some smaller agencies throughout the city of Wayne County. And so when they get those ones, they have a direct partner with Karra, who provides our crisis interventions. Like, they go out into the community and they will provide on-site evaluations of what's going on if a law enforcement partner has called them, and then they will, quote unquote, I guess, take over the scene, whereas law enforcement can, move on to another scene that may, really be a law enforcement call.
That's actually really great to hear, and I'm glad that this is something that's happening because, you know, sometimes mental health does take a certain approach, and, you know, that way you can be able to really have someone who is a specialist in there to help, and then, you know, police services can be allocated to where they're needed most. So I really think it's great that there's a share of this load when it comes to, you know, just making sure that people are safe. And I do want to circle back now that we have Karra here present, to kind of just answer some of the questions around, you know, we were talking about suicide prevention and things that, you know, have to do with domestic violence and substance abuse, and seeing the rise in those numbers, especially with the virus, just making people feel a little bit more stir crazy, a little bit more clustered. And so can you speak to some of the services that, you know, are provided by DWIHN? And, you know, a lot of people in the chat have kind of asked about, you know, what kind of services can people have face to face in our new virtual world?
Well, thank you, Ernestine. And this is Karra Thomas, representing Substance Use Disorder Initiatives. And of course, for me, I am the prevention coordinator that is over many of our programs across our region. Before I go to delve into to respond to your question on services, I do want to add to what Tinetra stated on what our law enforcement are even doing through behavioral health services and through our mental health areas as well. Because we do provide them, we have been for years in trying to have a connection and relationship with law enforcement and the policing departments across our 43 cities. We have been doing those trainings that not only with currently now is more so around the opioid epidemic and around addressing the needs, because medication is of course an assisted thing to mask a lot of concerns that are happening with our mental health and SUD communities. So we have been providing trainings and great relationships that we've had with Detroit Police Department across, and as well as out Wayne County departments. So we try to make sure we have reached those areas and build the relationships. So as the question in response to the policing, the relationships that we've had across Detroit Wayne have just grown, and it always reaching out to us even to make sure that there are these areas of gaps in services that cover a lot of the topics that they see or they're faced with, that we have been trying to make sure that they are equipped with or trained in. So I do want to add to that. As far as additional services, as things transitioned, of course, these past 8.5 months, as you mentioned, our providers are so adaptable for us in Wayne County. It seemed that we immediately tried to make sure that there were a plan in place for this virtual, for some those network of providers. They have really laid out the plan in having to adapt. No one that I know of in our region had to go through or go through any layoffs or anything of that nature. They just became helping those as an arm. When you ask about the suicide prevention, I know you've talked probably a lot about that area, because that's they more with the coalition that is a part of through Tinetra and Andrea, her supervisor's office. But there have been, each one of our coalitions, I think, across our region have reached out or been that arm available to that community that is helping, you know, various individual needs virtually as well as community-based. So they became very creative in doing their programs, as far as being on the call or being available as calling to reach out to them, to their participants, because the great thing that they had in place was having that relationship with either their program or participants. So they were able to reach them through there and try to keep them engaged. Of course, there have been definitely challenges around the domestic violence, just behind the scenes of things that have grown with the various topics that I have been trying to wrap our arms around, to allow them to be able to talk freely with us if they can, you know, in many of the homes, because the youth are are in, or their families could be in a domestic situation, we have offered our 800 numbers, our safe places that we still have in our treatment facilities that they can go to as well. So we've been, you know, at times even available as our 24-hour access line. Has been stated that we would try to have these services available. I mentioned those faith talks. I've mentioned various talks, but specifically, even with our faith-based leaders, we've had to have them to be that the hub or the locations for people to trust and go to address those concerns, because that's who they have more of the trust in. Even with what we had a conversation earlier tonight about the schools and the mental health. And if a teacher who has talking or seeing these students on the virtual screen are not social workers, but are having to become that even in the virtual screen, and seeing behind the scenes that this person that they're living with, that the youth are living with, or these different individuals have a lot of other challenges that we want to address. And so I would love to provide you with a list, of course, of places to go to, but we do have resources, and depending on the area that that person is in, we will try to connect them with organization in that area.
Thank you, and I'll be sure to like add the links to those facilities and those partnerships, so that people know that help is available. And that actually leads me into another question, and then we're going to jump into our segue into our last question. First responders have actually been going through a lot during these times, and especially having the conversation around having a behavioral health specialist team up with Detroit Police. What kind of services are actually being provided, and are you guys actually seeing that there are a lot of nurses and police and folks who are coming to you to seek these mental health services to help them with coping at this time? And Karra, if you want,
I'll attack that as well. Of course, I was thinking about all of the mindfulness workshops or the virtual trainings. We have been trying to make sure, even with, I don't know if this has already been stated or not, forgive me, but there is My Strength, our apps that we have, making sure that persons who are part of our regional area and even through the state, that we have services that are helping those that have reached out to us. Our numbers, of course, with when you mentioned the nurses or the police, I'm sure because of the number of increases in alcohol have been since this time, that we, and I'm not going to say they, that we have all been partaking in, because of this shelter in place. Our sales are off just on a rise of things that have become ways for people to go to. So substances is rising in that way. But we offer, of course, those who have reached out to us, no matter through our families programs, through our individual programs. We've even had programs that are still working with hospitals, and I believe, hopefully, MaryJo may have mentioned that earlier, in that we still try to make sure we connect any service for those who are working, those essential workers, to make sure that they have these resources that we share, to provide the screenings and help them to do those referrals appropriately to get the help that's needed. And I'll digress for a moment if everyone else wants to add to that.
I would add something. Just part of our training with the law enforcement officers, we have talked about self-care. If someone does reach out to us, of course, it's confidential, so I'm not able to share that information, but definitely we talk a lot about self-care, and we do offer individuals to download the My Strength app, as well as calling our Reach Us Detroit number. And I would like to share that at the end. I do have a slide with all of the information that I've shared is on it. just so that people can have it.
Sure, sure. I'll go ahead and, make that an option for you. Okay, thank you.
I was just going to add, teachers, Karra touched on it, how difficult this has been for teachers. And we have been working with the principal of Harperwood School, and this month we had DWIHN go in and talk to the staff about the resources that are available so that they can offer these resources to the kids, because they're seeing them, they're seeing what's going on, and they know what help these kids, or that these kids need help. We're going to be doing this on a monthly basis with Harperwood High School, just giving them different resources for the staff there that's really going through. I mean, it's tough on these teachers, what they're doing day in and day out. Next month, we're having a doctor from Beaumont going in and talking about self-care for the teachers. So just different things like that the coalition and DWIHN can do to help these people that are working so many more overtime hours and doing jobs that are very, very difficult.
Thank you. Thank you all for shedding so much light on, just these issues and showing us where the help can be found. And so sorry if there's background noise. My nephew is kind of noisy. So, for my last question, I really wanted to delve into just changes in the organizations. I know that CARE in particular has provided a myriad of programs for youth, parents, prevention, and employee prevention, employee assistance, and then for help for returning citizens. And so I kind of wanted to ask, what was life like before the pandemic, and how often were people utilizing the services? And then now, what will the future be like, and how has the mission of being community well-being oriented changed? So I'll leave that with you, MaryJo, and then I'll ask the same question of DWIHN Integrated Health Network.
Sure. Well, before COVID, all of our interactions and webinars were face-to-face. And then when COVID happened, we totally switched to Zooming. And in the beginning, we had quite a few people coming because it was new. It was an easy way to get the information. And for a while there, I thought, this could be something we could do for, a long time, because you're not driving somewhere. It's easy to do right from your home. But now we're seeing people are really getting Zoom fatigue. They're getting tired of it. So we're really trying to figure out different ways to get this information to them. Because the information is really needed. The things that we talked about before, dangers of underage drinking, the Narcan training that we do, the QPR program that we do. So really just trying to figure out how to get this information to them. After the first of the year, we're going to do a survey to find out, when do parents want these webinars? We've been doing it at 7 o'clock. Is that not a good time to do it? Is it better to do it at 9 o'clock after the kids are in bed, or at 6 o'clock while you're doing dinner? So we know that parents need this information, so we just need to figure out the best way to get it to them.
Thank you for your insight, and just kind of letting us know that you'll always be here. And the same question, I think, Karra, we can kick it off with you and then close it out with Tinetra on what did DWIHN Integrated Health Network look like before COVID, and how have you guys maybe completely changed, and what do you see the mission doing for our post-COVID lives?
Well, I stated a little earlier on some of those changes with our moving into the virtual world, but we are a wraparound. So, and we are a community, so we like to touch. And so, that was very hard, I think, for a lot to even learn these systems. Just thinking on just from the various ages that we do work with, not just in our organization, but who we are serving is the challenge of how we were able to get to them. A lot of our programs have even started doing door-to-door, meeting up at those faith-based organizations that had to do the food giveaways or the COVID testings that have been happening. There was a way to connect out when it was warmer, of course, to be able to still do some more things out and outside and still be able to engage. But as through our programs, I was asked or tasked to ask our providers, what is it that is your emergency plan? What is the plan that you have put in place? Because they are, they are funded agencies to do these programs, and you have to have an if then in place. A lot of their agencies had some things in place in preparation, or were technologically savvy to move into those things. And because they also had youth-led um, uh, support, or youth working with them to even engage with those who needed the help. Ask what was that. And I think that has been a part of what our department has adapted to, seeing what is it that you went from 3 days in the school classroom, or you went from having your coalition meetings to now boots on the ground. Is really literally virtual boots, but virtual door to door. If you were able to do that, or allowed in your space to safely go out to do one-on-ones, to do it outside of, in a sense. And then I did want to just briefly share, as I said earlier, our faith leaders are really the ones that I felt we were very successful in going to. We did host a Wellness Beyond the Walls conference this year, virtually for 2 days. And I think from that, we had a plethora of topics to talk about, what you have been asking us on. And behind the closed doors, what happens with those, since places of faith have had to see their audiences transition or go into different, or not even attend. So what has that felt like, from them having hundreds of people maybe in their congregations to having 50 on their screens? So that has been one thing we've been doing weekly, is having prayer calls, and that is helping. From one of the people who work in hospitals has been doing our leads, Dr. Portia Locken, and I always like to give her a plug, is that she provides leadership on giving us a 5 minutes of uplifting. She's a chaplain in DMC, and you're talking about somebody who has to be that hands-on person that's been seeing people who couldn't have their loved ones with their loved ones in the hospitals with them too. So we've got so many things that we've had to adapt to, but we still are trying to find ways to also maintain, as we stated earlier, with mindfulness and self-care, because we as staff also need to remember to do that too, to take care of ourselves while we're trying to help others.
Right, right. And that is very hard to, stay on top of it when you're trying to take care of everybody else and then take care of yourself. And, then you have like extraordinary circumstances that are playing out for the rest of the world as well. So thank you so much for, really being able to give us perspective on, just the mission of, the organization and how we can all cope with COVID. And Tinetra, your closing thoughts on, just the changing mission and then life before and after. Okay, well, thank you. I think we got the crux of, what you were saying, and, thank you so much for shedding the light that you do. And thank you so much for all three of you ladies working so tirelessly to, make sure that people are provided for, make sure that there is support, that there's help, that there's a network, and, that all of Wayne County can benefit from services that, are really going to help us be able to cope and thrive. And, during such, strange circumstances that have brought us into something that we hadn't had to deal with in 100 years. So thank you so much, ladies, for being a part of Quick to Politic today, and thank you so much for your time and for your insight. I'll be sure to link in all of the information that was mentioned in today's episode, as far as the links and the information that was provided. So and how can people find you guys individually? If there are emails, I can, if you could drop them into the chat, I'll share them via the web, and that way people can reach out to you. But once again, thank you.
Can I share my screen? I wanted to do that.
Oh, absolutely. And you're crystal clear now.
Yes, she is.
It sounded like a little bit of an exorcism that was going on there or something, but we could kind of hear you. So this is much better.
Okay. But definitely, big changes that we're doing things much smaller, that it's virtual. If we do have the opportunity to be, with individuals, it would be on a much smaller scale.
Okay, so now you have the ability to share your screen as well.
Okay, so let me see if I can do that.
While she's doing that, Ernestine, I definitely want to make sure we get you the 1-800 number, so we get that out. Because, people need to remember that we're all going through something, that they really, if they need help, that there's resources out there. CARE has resources for people who are going through substance use issues. They pair them with a recovery coach. DWIHN has all kinds of information, mental health and substance use disorders. So hopefully we can really get those 1-800 numbers out there.
Yes, yes. And so I'm also going to share this on my website, and I'll share this in the networks as well. Drop it into the chat here. So thank you guys so much for joining me. And I hope you have a wonderful, happy holiday if I don't see you all. And we are now